Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So today we will be seeing about play in pediatrics, importance of play and therapeutic play. So why we have to consider a play in a treatment process? Because the play, it increases the intellectual development, motor development. In motor development, it develops the fine motor skills and gross motor skills, and the same way the play will inculcate the improvement of the language in the children's. So when we consider the pediatric nursing from the ancient times to the recent times, we can see that in the ancient times these play therapies was not included in the treatment process of the children. But whereas now the pediatrician, what have decided is, like, we have to include the play therapy in the treatment process. So when a acutely ill child is been in the bed for a very long period of time, the child will long for the play. And also nowadays what happens in many pediatric hospitals, there is a separate place for the play activity. So they have inculcated that the play is very much important in the prognosis of the disease of the children as well as improvement of all the development. That means it will develop the intellectual development, moral development, motor development. In motor development specifically, it will develop the fine motor skills and gross motor skills, and also that the play will increase the language development in the children. So how it is going to improve the moral development is, the babies will share their toys with others, and they will not they will mingle with other children and play. So that is going to improve the moral development of the children. So we have varieties of play, like children will be mingling with each other, or they will have a competitive play, and also what happens, they will make a competition among themselves, like running races, skipping, like that. Next is, like, they will all together, they will combine together and associate with and play, and also they will manipulate with mud and clays. And also there are plays which involves coloring and like a solitary play, that is playing alone for a very long period of time. And also like cooperative play, they will cooperate with each other and they will play, like cooking or acting like teacher or acting like a doctors. So they will have a different kinds of play. So each and every age group have different play. So we will see one by one in detail. So introduction. Play is a universal to all children. So it is work for the and ways of their living. It is pleasurable and enjoyable of child's life and essential to promote growth and development. Play is the activity that has no serious motive and from which there is no material gain. So from this it is very clear that the play is going to improve the growth and development of the children, and also it does not have any serious goal for doing any play activities. So it comes spontaneously, and also it going to improve the enjoyment in the children. So that is in simple term known as play. So definition, it consists of those activities performed for self-amusement that have behavioral, social and psychomotor rewards. It is child-directed and the rewards come from within the individual child. It is enjoyable and spontaneous. This definition is taken from Encyclopedia of Children's Health Forum 2021. So according to this definition, the play that the children is having the activity is, it is a spontaneous process, and also it is going to induce the enjoyment in the children, and also it is going to improve the behavioral, social and psychomotor reward. That means the psychomotor skills in the children. And also we'll see the importance of play in pediatrics. So play is an important part of childhood development. Through play, children learn about shapes, colors, cause and effect and themselves. Besides cognitive thinking, play helps the child learn social and psychomotor skills. It is a way of communicating joy, fear, sorrow and anxiety. Through play, decisions are made without penalty or fear of failure. So plays allow children to gain control of their thoughts, feelings, actions and helps them achieve self-confidence. So the play activity, so for example, the child is playing with the shapes. So they will manipulate the shapes and they will learn that this is square, this is circle and this is going to be the sphere. And also in some of the play activity they will squeeze it, and they will learn the colors, and they will, by squeezing, they will understand the texture of the play materials. So anyhow the play is going to inculcate the knowledge in the children. Next is categories of play. So categories of play are not mutually exclusive. Different forms of play, of categories of play, may overlap. An understanding of play in many forms can help the parents to understand the importance of play in children's development. So one is dramatic play. So what is dramatic play is, we will think that about some of the heroism from the cartoons. For example, I am watching the cartoon of any cartoon, for example Chota Bheem, or any other cartoons like how to say, any examples like Tom and Jerry. So they will think in that way, and they will act like a cartoon creatures. So whom they love the most in their cartoon creatures, they will act like that. That is known as dramatic play. And the same way, dramatic play is also like they love the teachers in the schools, right? They will act like their teachers. So these all comes under the dramatic play. So they will act like someone whom they like very much. Like sometimes the children will be playing like mother or father role, or the brother role or sister role, or their favorite teacher, favorite friend, or favorite family members in their families. Next is physical play. So the physical play which involves their physical strength, they use all their gross motor development, gross motor activity, and the fine motor activity. For example, running, cycling, hide and seek, peekaboo games, like that. They use all their physical strength in doing the play activity. Next is expressive play. So expressive play is such a way that like it can be used for the children's above preschooler or school age. For example, the child is having very much of anger. So when the baby is having any toys, that is soft toys or any punching bags, they will do a continuous punching in that. So what happens? They are going to direct their anger or frustration towards that play articles. That is known as expressive play. So like and also like they can, if you are giving any drawing materials to them, they will continuously scribble. So that what happens, whatever they are having in their minds, that will come as a play. So if they are very happy, they will do it very spontaneously, very smoothly they will do the drawing. So whereas if they are very anger or frustrated, they will just scribble like something, or they will punch like anything, like that. They will express their own emotions on the play articles. Next is manipulative play. So manipulative play means it is very common in infant. So if you have seen the infant, no, like if you are giving any rattle to them, what happens? They will shake that rattle and they will drop it down. So they will see their parents. So what happens? The parent will take that rattle and they will wipe it and give to the children. Again the baby will what do? Again it will drop it down. So it is a spontaneous one. So the baby thinks it has a very enjoyable one, and it is a manipulative play. Next is symbolic play. So symbolic play means, for example, if a child is being in the abusive families, so the baby is undergoing very much of depressions or emotional instability. So what happens? That will be directed towards their own dolls the baby is having. So the child will cuddle their toys, or they will give kisses to their toys, and they will look after the toys very carefully, thinking that they wanted to be like that with their parents. That is a symbolic play. So wherever they are seeing the televisions, so for example, if they are liking some of the cartoon creatures, they will pretend like that cartoon creature and they will play. That is also known as expressive play. Next is familiarization play. Familiarization play means children handle the materials and explore experience in reassuring, enjoyable ways. For example, they know that they are going to have a painful experiences such as surgery or parental separation. They will play accordingly to that. Next is surrogate play. So this is applicable for the children who are very acutely ill. They are being in the bed for very long period of time. So they will be only watching other children playing. So they will be lying on the bed. Maybe they, in one hand there will be IV administration will be going, or on other hand maybe the blood transfusion will be going for the child, but the child will be looking on the other child who is playing. That type of play is known as surrogate play. So it is going to stimulate the play activity on the children who is acutely ill, and all on by seeing those children they will enjoy themselves. Next is games. Some video and card games are played by one child alone. So games with rules are rarely played and the children younger than 4 years of age. So here what happens is they will play all types of games like chess, carom boards, or the play which requires rules and regulations. But the children below 4 years of age, what they will do is they will not follow any rules and regulations. So simply whatever they are thinking in their mind, they will play. So like if they are playing the chess means they don't know, like the horse moves in a L shape movement, or the queen moves in the diagonal movement or straight movement. They don't know the rules and regulations, but they play according to their own rules and regulations. Next is functions of play. So functions of play is this play activity is going to improve the language development in the children, intellectual development in the children, moral development in the children, motor development in the children, and also physical development in the children. So physical development in the sense it is going to refine both fine motor skills and gross motor skills. So when the children is repeating one of the movement again, what happens? The children becomes specialist in that particular movement. For example, the child is running. So again and again if the child is running, the child becomes very specialist in running race. Next is emotional development. For example, like they will be having role playing games or any fantasy world games, so they will have emotional stability towards the play activities, and the same way they will share their toys with others. And also they, for example, they are having a running race, so one is getting defeated, so they will have a good sportsmanship in the play activity. So that is going to improve their emotional development, and they are going to improve, this play activity is going to improve their self-esteem and self-awareness, and also a good sportsmanship among the children. So first we have seen the child is going to have the physical development while doing play activity. Next is emotional development while having the play activity. So next the child will have the cognitive development. So cognitive development in the sense they are going to have the problem solving things. So they exercise their ability to think, to remember, and to solve the problems. And also like children increase their problem solving abilities through games and puzzles. And for example, the puzzles are there, the child will have the problem solving ability of uniting those puzzles in a very quick way. So each and every children have their own cognitive development, and also they will have a social development. So how they are going to have social development is, so in infant we will see the infant is making a sound of coos and vocalizes. So what happens, the parent will repeat after the baby, so again the baby will repeat after the parent, so it becomes as a expressive language. And also it whenever the baby hears the voice of their parents, the baby will giggle out. So that is going to improve the socialization. And in older children they will improve their teamwork, taking turns and competition, and learn about the boundaries. For example, they are having running race, so once get defeated they will have a good sportsmanship. Okay, this time I got defeated, so next time I will improve myself. So they will have a socialization, they will have a variety of friends towards them. So next is moral development. So what is mean by moral is like we have to accept the things, so that is known as moral. And also good things and what is bad things, so differentiating between what is good and what is bad. So if a children are playing, so what happens, one child is beating the others, so suddenly the parents are coming and telling like beta, you should not beat other children. So what happens there, the development of moral development takes place. So then again next time what happens, the child will think, okay, my parent has said me that I should not beat others, so while playing this also gets improved, that is moral development is also gets improved in the children. So next we will see about the stages of play. So each and every age group have the stages of play. So like the infant, we cannot compare the play between the infant and the toddler. So each and every age group have different plays. We will see one by one in detail. So the list explains the different types of play in the children. So first one is unoccupied play between the birth to 3 months. Solitary play from birth to 2 years. Spectator or onlooker behavior play, that is 2 years. Parallel play 2+ years, associate play 3 to 4 years, and cooperative play 4+ years. So in the beginning we have seen the categories of play is not exclusive, it overlays on another each and every age group. So this is by this which is very clear that each and every age group overlays on the play. So unoccupied play means they don't play with any materials, they just watch other children's. Solitary means they are playing alone for a very long period of time. So onlooker means the baby is watching the other baby playing. So parallel means the two children will be playing beside of each other but they don't mingle with each other. Associative play means they will associate among their age group children and they will play. For example, like I am going to be the teacher, I am going to be the father, and you be the mother. Like that we will associate and play. So cooperative play means, for example, we are playing the carom boards, ludo. So we will cooperate among ourselves and we will select our color codings and we will play. So first is unoccupied play. So it looks like babies or young children exploring materials around them without any sort of organization. This stage allows the children to practice manipulating materials, mastering their self-control, and learning about how the world works. So for example, we are giving the rattle to the children. So the baby will do the manipulation of that material, or the baby will just swallow it. Not swallow it, sorry. The baby will just put it in the mouth and see how the shape is, like that, known as. Next is solitary play. So solitary play means the baby who is playing alone for a very long period of time. So that is known as solitary play. So if we are giving any toys to that children, means that baby will play with that particular toy for a long period of time, or then shift to other toys and then play. Next is parallel play. So it is a form of play in which the two children play beside of them, but they two children will not mingle with each other and they do not try to influence one another's behavior. So that baby will be playing their own games, and the other child who is beside of that first one baby will be playing their own games. So they will not mingle with each other. That is known as parallel play. So this play is usually observed in the children as early as 6 to 7 months. So like railway tracks, know how it is parallel, it is not meeting with each other. That the same type we can have that example with this type of play also. So next is known as associative play. So they are going to have the association between other peer groups and they will play. For example, like they will think themselves have the teachers or the doctors, or like they will say like I'm going to be the doctor, you all going to be the teacher, or you all be the patients. Then if they are playing like police and thieves, means one will be the authoritative person will be telling like I'll be the police, you be the thieves. Like that they will associate themselves, like stories that is being listened by their parents or grandfathers, that they will act in their play activity. So that is known as the associative play. They will associate with any of the instances that has taken place in their family or in the cartoons or whatever they have learned from the stories from their family members like grandfathers or parents. So whatever they have said, one of the children, that child will make up a story and associate and play. Next is cooperative play. So they will have their own rules and regulations in their play activities and they will play accordingly. For example, we all also have played like help my sister or a lock and key, hide and seek. So they have their own rules and regulations and they will cooperate among themselves. They will have that behavior of cooperative with the other children and they will start playing accordingly. So next is a competitive play. So competitive play, from the word itself, it is very clear that they are going to have the competition among the children. So in the school age and all, what they will do is like they will do the running race or running with a sack, lemon and spoon, or having a race with the skipping ropes. Like that they will have a competition among them and they will see that who is coming first, who is coming second, third. Like that among them they will have their own competition among the children. So it is going to improve the good sportsmanship. So if a child is getting defeated, means they will improve their sportsmanship in the next time. So if he is coming first, means he will improve, he will continue that in the next play activity. Next is constructive play. So constructive play teaches kids about manipulation, building and fitting things together. So examples including building with blocks, magnetic tiles, making a road for toy cars, or cognitive skills are used to figure out how to make something work best. So that is constructive play. For example, we are having the building blocks, no? So we are going to build one by one, and by using our intellectual development, we are going to build the blocks. That is known as constructive play. So next is dramatic or fantasy play. So dramatic or fantasy play means they will dress up like models or like heroines or doctors or teachers, and they will dramatize themselves, and they will be in the fantasy world which is not at all associated with the real world time, and they will start playing like that. So like they will have a child's imagination, like I'm coming in the car, or I'm riding the bicycle, I'm riding the bike, like that they will imagine themselves and have a play activity. That is known as dramatic and fantasy play. So next is physical play. So physical play which involves the improvement of the gross motor and the fine motor skills, that really going to improve the physical activity in the children, like climbing or skipping, hopping or running or back walking, swimming, like that, which is going to induce the physical activity in the children, is known as physical play. So next is symbolic play. So symbolic play in the sense like whatever they are thinking, no, they will do it in the play activities. For example, I am giving any crayons or any papers to them. They will symbolize themselves and they will draw it in the papers. That is known as a symbolic play. Or it includes the singing. If they are very happy, they will crack the jokes or rhymes, and drawing, coloring, working with the clays, everything. So next comes the therapeutic play. So therapeutic play means the play activity we are going to increase or induce in the children who are acutely ill in the hospital and they are hospitalized. So this is being accompanied by the healthcare personnel during their hospitalizations. So the who and all feel stressful, scared or confused or out of control, the hospital they will provide a play area where it is going to improve their play activity in the children. So when the children is having the spontaneous play activity, so it is going to help in the easy recovery and early recovery of the children from the illness. So in nowadays what happens in many pediatric hospitals, they are also doing the physical infrastructures for the play areas. So when a baby is in the bed, after doing all the treatments or any medications or their routine works, they can come and have the play in the play areas. So that is known as the therapeutic play. So the play activities we are going to inculcate in the children who are acutely ill in the hospitalization. Next is common problem in promoting play for a sick child. So we encounter very much difficulties in encountering this play in the sick, because they are already very physically exhausted and mentally they become very depressed. So how we are going to improve the play? So parents need to realize that the importance of play during their hospitalization. One, because you say no, like the child requires play means they will be telling like my child is getting hospitalized, why you are asking the child to play, like that some of the parents will be telling. So it is very difficult to make the parents to understand the inculcation of play in the physical activities in the hospitalization mainly. Next is assessing the child health through play. So acutely ill children do not have the strength and attention towards the play activities. So when all the time they will feel comfort by holding their favorite toys and all, and when the child is returning to the interest of play, we will come to know that they are going into the recovery phase. So if the baby is having a high fever, so increased temperature, so that time what happens, the baby will not have attention towards or interest towards a play. So when the temperature gets down, automatically the baby will jump and the baby will go into the play area. So we will know that the baby's recovery process is taking place like that. So that we can assess the child through the play activities. So this play is going to be the good indicator of the child's recovery progress. So we will come to know the baby is in the recovery progress, that is the baby from the acute illness, she is going into the normal growth and development of the children is improving. So that is known as assessing of child through the play. For that purpose only, from the ancient times, the trends of nursing, we have inculcated the play activities in the nursing care or the medical care of children. Next is play in a medical setting. So inculcating the play activities in the medical setting is very difficult. Why? Because all the children will be acutely ill. They do not have that much attention or interest towards the play activities. So we as a healthcare provider, we have to provide the play articles to the children, and also we have to encourage the children in the they have to bring their own favorite toys or any coloring books like that, or the sibling who is going to come and see the children who are being hospitalized, they can also bring the toys material, so that the child will have the interest towards the play, and also it is going to induce the recovery progress in the children, and also they will feel like they are in their home settings like that. And also the children in the hospital for a week or longer may enjoy playing school or socializing in the playroom with other children of their age. So that's all about the therapeutic play. So next is, when the child is ill or traumatized, the care plan may include therapeutic play. So even in the pediatric nursing, we are including the play therapy in the planning in all the nursing diagnosis, so that the play therapy is going to improve their intellectual, moral, and also the language development in the children. And also we can also, by seeing their drawing, for example, I am telling one of the child who is being hospitalized to draw something, the child will draw whatever the baby is having on their mind. So if she is feeling very sad, she will draw a smiley with the sorrow faces. So by we can give the health education to the children and family members. So if she is very happy, she will draw very happy images. So based on that, we can assess the child's mental status as well as the health status. So play is going to be the one of the indicator of the child's health status and the health progress. So next we are going to see the energy release. So what is energy release? That is, whatever the child is feeling inside, the child will have that expression on the play activities, right? For example, during the hospitalization, the baby is feeling very pained or frustrated or anger. If we are giving any toys or something, no, they will do like punching, hitting on others like that. So they are going to release those energy on the others materials like their toys or pillows or punching bags like that. So it is going to improve, or they are going to release out their frustration to the other objects. Next is anatomically corrected dolls. So anatomically corrected dolls means, for example, the child is going to have the colostomy bag. So colostomy care. So we can make the toys exactly like how the baby who is being hospitalized, and we can say that we are going to clean the colostomy bag, so that the child will give us a accent like, okay, you can do it, or like we can give the injection to the dolls, and we can say, see, we have given injection to the dolls, now I am going to give the injection to you, like that. We can compare those with the dolls, and we can give the treatment process. Next is dramatic play. So like the baby will be telling like, if as a nurse I have given an injection to the child, so child will be feeling very anger, then she will be telling to her toy that the sister has administered toy injection to you, know, it is very pain, is it so, like that she will be thinking as a doll, and the baby will be telling like that. So by that process we can assess that the child is feeling pained or angered or frustrated. So that is known as dramatic play. So creative play means something which is being, it is one type of dramatic play only, that is expression of their emotions, and they communicate whatever they wanted. As I have said, like the children will be telling to their dolls, is it paining for you? The nurse have administered the injection to you, is it paining? Like that they will talk with the dolls. So that is one type of creative play. And again what and all will do is like, if you are giving any paper or any crayons, is whatever they are feeling they will draw in that. So I am asking the child, so whatever you are feeling, you draw it. So the baby will draw like the baby is getting punishment, or something being get fired, or something negative scenarios the baby will draw when the baby is in the hospitalization, thinking that they are in the hospital due to the punishment, like that. So based on that we have to teach them and give a health education. Next is selection of play materials. So we have to select each and every play material according to the age group, and also we have to see that the small parts in the toys should not be there. So the small parts like batteries or any small like lithium batteries or magnetic toys, if it is being very small, the baby can swallow and it may lead up to any further complications. So like the fires or any sharp objects nearby the hot places, it should not be included in the play activities. So we have to be very careful while selecting the play articles to the children. So we have to be very much careful while selecting the toys. For example, in some of the toys materials, no, they will be written like recommended for the age group between 6 to 12 years. So for that 6 to 12 years only we have to give that toys. So below 6 years or above 12 years you should not give. And also we have to be very ensure that the small parts are not there, and also the lead paint or any inorganic materials is being there, or the child who is swallowing some of the materials, that and all should not be given to the children. And also high sound producing toys should not be there. So first is read the label. Warning labels given in the labels. For example, the recommendation for 3 to 6 years. So according to the age we have to select the toys. Next is think large. So whatever we are selecting as a toys, it should be bigger than the baby's mouth, so that the baby will not swallow it. And avoid the toys that have a small bean like pellets or stuffing that may cause choking or suffocation. And for the infants, you should not use any toys that has a long threads that may cause a strangulation in the neck. And also we have to be very ensured that avoid toys with the toxic materials that could cause poisoning, and make sure the says non-toxic. And also the small particles should not be there, so it may end up with the suffocation. So we have to be very careful while selecting the toys for the children's. So far we have discussed about what is play, what are the types of play, what are the categories of play, what are the functions of play. The play is going to improve the intellectual, moral, emotional development as well as the fine motor and gross motor skills. So we have to encourage the child to have the play in the day-to-day life, to have their physical activity. And the same way, when we compare from the ancient nursings to the recent nursing times, that too in the pediatric nursing, we have inculcated these play activities in the treatment process also. Why? Because it is going to improve their health and recovery progress. So if you have any doubt, kindly drop down in the comment box, or if you want me to take any other topics, kindly give me suggestion in taking the other videos, so that I can post the videos according to your need. Kindly like it, share it and subscribe it, and watch full videos. If you find useful, kindly share among your friends, and have a continuous learning in your profession. Thank you for watching.